Hello, my name's Ian Davis. I'm Chair of ANZUP Cancer Trials Group. I'm speaking to you from the 2024 annual scientific meeting of ANZUP being held on the Gold Coast here in July 2024. It's a great pleasure to be speaking today with my friend, Professor Paul Nguyen. Paul is a radiation oncologist, Professor of Medicine at Harvard Medical School and based at Brigham and Women's Hospital and Dana-Farber Cancer Institute. So Paul, thank you. It's great to have you at ANZUP. At long last, we've been trying to get you here for a very long time.
Yeah, thanks, Ian. I'm so happy to be here, finally. It's been such a long time coming, and we've worked together for so long. I'm so happy to finally be at this incredible meeting that you put together. Congratulations on the record attendance.
You've been a fantastic contributor to ANZUP for so long, but you gave a talk today about value in healthcare, bang for buck. Can you tell us a little bit about what that means and what the messages were from that?
Yeah, I mean, I think we all know all of our healthcare systems are spending a greater and greater percentage of our GDP on healthcare. And obviously health is super important, and we all agree upon that, but we also have, each of us, a limited number of dollars that we can spend. So a dollar spent on one thing is a dollar less that we can spend on something else. And even within the healthcare bucket that we're going to spend, we have to think about how to use those dollars best to optimize everybody's health and spend less on things that aren't that cost effective and put more money into things that are really cost effective. So that's what the whole discussion was about today, is how do we maximize our outcomes while keeping the cost as low as possible.
So how do we think about that? What are the sort of considerations we need to be taking into account?
Yeah, I mean, so the key equation is value equals outcomes divided by costs. And the outcomes we can think about as the outcomes that matter to patients. So how long am I going to live? What's my quality of life going to be? Those are the key things. And how do we maximize that? Well, the first thing is we have to measure that. We have to measure what we're actually doing with our treatments. And I think that there's still a long way to go with that. You know, there's the ICHOM initiative to actually standardize measurements of patient-reported quality of life and health outcomes that matter to people. So I think we need a standardized measurement that's transparent to everybody so we can, first of all, maximize the numerator of that equation. On the cost side, the tough thing is that we often don't pay that much attention to costs. We often feel like, look, if there's a drug that improves survival by a few months, we deserve it. But you know, we have to look at costs and figure out what is cost effective so that we can optimize those dollars the best. And the other thing is, you know, ultimately, I exist in a fee-for-service model. I think Australia partially exists in that model. And that model, unfortunately, does contribute to incentivizing us physicians to use as many resources as possible. But there may be other models that help us to think the right way and keep the cost down and really maximize societal benefit.
Well, we do work in different healthcare systems and it's hard to generalise, but we also have to face this tension where on the one hand, I might be sitting across the desk from a patient wanting to do the very, very best for this person in front of me. On the other hand, we've got a responsibility to steward healthcare resources for the system as a whole. How do you address that sort of tension?
Yeah, I think that's such an important question, and I totally get it. When you're the patient and you're facing this life-threatening situation, you want to do anything to survive that extra month, that extra week, and you don't care about how much it might cost. And I think we don't have to put that onus on the individual physician. This is more of a societal problem. This is a problem where policymakers need to think about all the waste that's in the system and how do we reduce that waste and cut down that waste so that we can actually free up more dollars to spend on the things that we want to spend on for patients. But you know, once that system is set, as an individual provider, no, I don't want you to be thinking about dollars and cents in terms of, is this patient going to live longer or not? I think that's the worst scenario. You know, we don't want to be saying, no, you can't live longer. I'm going to save these bucks for something. No, that's not what we want. I think it's more of a systems approach to cut a lot of the waste out of the system and have a system that's going to be more rational in terms of the rules that it sets up. But once those rules are set up, you should optimize for that patient in that situation.
Yeah. And you know, we're a trials group at ANZUP and we're fixated with improving outcomes for people affected by these below-the-belt cancers. Survival, as you just mentioned, is often the thing that people gravitate towards, but there are other outcomes that might be just as important, if not more so. Do you have those sort of conversations as well?
Yeah, I mean, we hear it all the time from patients. It's that they'll say, Doc, I don't care how long I live, I just want to have a good quality of life. A lot of patients that feel that way. Now, not everybody, obviously, but you know, enough patients do that. I think it's so important that we measure quality of life really carefully and really consistently across our trials. And that's where ANZUP That's where other cooperative trial groups have the real opportunity to be leaders there by really carefully measuring quality of life so that we can tell patients and society, okay, this drug will improve survival by this much, but also quality of life by this much.
There's a lot of advocacy work we can be doing for society and the system, but there are also things that we can do as individuals and as specific groups in which we work. We can actually do some work at home as well to make improvements here.
I mean, absolutely. I mean, even in one's own clinic, I mean, do we have in our own clinic standardized measurements of quality of life? Are we tracking every patient so that we know how our own outcomes are? I mean, I think that's so important.
Yeah, working in the dark otherwise.
Yeah.
Look, thank you so much, Paul. It's been a pleasure to have you here again at ANZUP and wonderful to talk to you today.
Thanks again, Ian. I've loved it here. Congratulations again on a great meeting.